Dr. Alex Canseco. I'm a mom, a vet, and a creative. So this video is for you if you are pregnant, looking for things to avoid during pregnancy, or maybe you work in an environment that has chemicals or other hazards just like I do and want to know how you can best protect yourself and your growing baby.
In the first part of this video, I'm going to cover a couple more consumable items that may be dangerous during pregnancy, and then we'll move on to environmental factors.
So there are certain sweeteners that you should avoid during pregnancy, especially if you have gestational diabetes, diabetes insipidus, insulin resistance. Some of these sweeteners, for example, saccharin, which is contained in sweet and low, has the ability to cross the placenta and accumulate in the fetus, and we just don't really know about all the detrimental effects it can have. So I would avoid that sweetener. Also aspartame, which is commonly found in soft drinks or pop or whatever you want to call it, diet drinks, and chewing gum is broken down in the body to methanol, which in turn is converted to formaldehyde. So that is a nasty one. Definitely want to avoid it. You also want to avoid simple carbs because they can cause constipation. So make sure that you have a diet high in fiber. Now here's an interesting one, licorice. But there was a study that was published in 2017 in the American Journal of Epidemiology that found a loose link between large amounts of licorice root or black licorice candy and earlier puberty, lower IQ, and behavioral problems. Nitrate containing foods, so in particular processed meats. The nitrates in cured and processed meats such as bacon, hot dogs, ham are known to be carcinogenic. Well, what about the nitrates in vegetables, you say? Well, those nitrates are actually beneficial and they can help promote heart health.
And that's a wrap for the consumables portion. Now let's move on to environmental factors to avoid.
Now here is one that I was really worried about while I was pregnant, and that is hair coloring, hair treatments. As you can see, I have a lot of gray hair, and I've actually, as you can probably tell, stopped coloring my hair. But there really is no definitive research to prove that hair color applied during a pregnancy is dangerous to the developing fetus. There are chemicals, of course, in hair dyes that can have the potential of being absorbed through the skin, but from what I've read, the absorption would be minimal, and really there is minimal risk. But if you really do want to color your hair, there are lots of different things that you can do to minimize chemical exposure. So you can wait until the second trimester to dye your hair after the most critical stages of fetal development have already passed. You can use pure vegetable dyes such as henna. You can look for natural products or products that contain less chemicals. So those products will typically state that they don't have parabens, they don't have ammonia, they don't have PPD and resorcinol. You can also have highlights put in your hair to make sure also that the area that you're in, the hair studio is well ventilated, that you rinse your scalp thoroughly after coloring your hair, and if you're doing it yourself, make sure you're wearing gloves.
So I came across this first myth a few times online, and it is that pineapple, papaya, and lychee can lead to premature contractions and even miscarriage. So the fact is that pineapple cores contain high levels of the enzyme bromelain, which may cause softening of the uterine lining and contractions, but you would have to eat quite a few cores for this to happen, and most pineapples are cored prior to eating. It's pretty tough. Papaya is safe to eat during pregnancy as long as it is ripe, and lychee is generally safe, but can be a problem if eaten in excess. However, there is limited research available regarding any of these claims.
What about some other beauty products that could potentially be harmful? What about nail polish? I have some examples of some nail polish that I bought that don't have some of the more harmful chemicals in them, such as formaldehyde, toluene, phthalate, and camphor. And This one's called Mineral Fusion. I really like this one. This one was actually nice and smooth. Color was even. This one is called Sun Coat, and this one apparently is water-based. But this one was really streaky when it came. It wasn't smooth. I didn't like it. I tried it in a couple of different colors. Not as good. There are lots of major beauty companies nowadays that actually do produce nail polish with limited chemicals in it. There are lots of options, not just with nail polish, but also with other beauty products such as foundation, eyeshadow, eyeliner, mascara, all of that stuff. So it's almost summer here in San Diego, California, at the timing of this, at the filming of this video, and you might be looking pretty pale and you're wanting to put a fake tanner on. The chemicals in fake tanner have not been linked to any major problems in the developing fetus. The main issue with fake tanners is that they can cause an allergic reaction. So make sure you're doing a skin test, a small skin patch test, before you apply it all over your body.
How about another myth? In several cultures, it is believed that when a woman looks at an ugly animal, her baby will then resemble that animal. Is it even possible for animals and babies to be ugly? Seriously?
You're probably feeling sore, especially later in pregnancy. You know, your muscles are aching, your back is aching, and you're wondering, can I get a massage? Can I get acupuncture? The answer is maybe. So it really depends what kind of massage you're getting. For example, in early pregnancy, you definitely want to avoid abdominal massage, and you want to avoid reflexology at all points in pregnancy. What you want to do is you want to make sure that you go to see a professional that has a lot of experience with pregnant women and knows what they're doing, that they're not giving you a massage or acupuncture or treatment that could potentially induce labor. So you're pregnant and you are wanting to paint your baby's nursery or renovate the home. You want to get everything ready before baby is born. What about those paint fumes, or the risks of paint fumes? Well, it's low with modern day paints. Most paints have low levels of volatile organic compounds, or VOCs, in them these days, but there is limited research available on the effects of paint fumes on unborn babies. So you just want to be careful if you're working on a home that was built before 1971, because in those homes they typically use lead-based paints, and as you're renovating you can aerosolize the lead, which is extremely harmful. So that is the problem. I would recommend at least, looking into some personal protective equipment, such as, a mask like this. This is what I wore during my pregnancy at work, because we are exposed to anesthetic gases, and I'll talk about that a little bit later in this video. But at least doing that, or having someone else do it. Just don't be involved in it if you don't have to. Other chemicals to think about are cleaning products, glue, paint, etc. Any harsh smelling chemicals.
Time for another myth. So in ancient times, women were told not to step over ropes. In modern times, this also includes electrical cords, because it can lead to nuchal cord in the baby, where the umbilical cord becomes wrapped around the baby's neck. Surprisingly, there are no studies to prove that this is true.
Now, you're probably not going to be interested in doing much of this during pregnancy, and that is contact sports, heavy lifting, but you definitely want to avoid that. The risks are obvious, as well as certain amusement park rides. What goes hand in hand with contact sports and strenuous exercise is excess heat. So if your body temperature goes above 0.2 Fahrenheit, or 38.9 Celsius for more than 10 minutes, the elevated heat can cause problems with the fetus. Overheating in the first trimester can lead to neural tube defects and miscarriage. Later in pregnancy, it's less of a risk to the fetus and more of a risk to the mother, in that it can cause dehydration. So you want to avoid hot baths, showers, saunas, jacuzzis, sunbeds, hot yoga, sunbathing for too long, and once again, strenuous exercise. This one was really difficult for me because I love hot showers. So being a veterinarian, x-rays and radiation exposure were a big risk factor for me. And fetuses are particularly sensitive to radiation during early development between 2 and 18 weeks. It can definitely cause major birth defects. Later on, after about 26 weeks of pregnancy, the risk of radiation exposure is comparable to a newborn, and that is that it increases the risk of cancer down the road. Now, here's one that you might find interesting, and that is ultrasound being a problem during pregnancy, because we regularly get scanned during pregnancy. So, research led by a doctor from Yale University, Dr. Pascoe Rack, revealed that prolonged exposure to ultrasound disrupts brain development in mice. Also, Israeli researcher Eitan Kimmel had found that ultrasound can alter human tissue as it creates little air pockets inside cells. Also, the FDA discourages any non-medical ultrasound, and the American College of Obstetricians and Gynecologists specifies that ultrasounds should only be used to answer relevant clinical questions. So maybe we need to reconsider doing those really cute 3D ultrasounds.
Time for another myth, or is it? That heartburn can lead to a more hairy baby. There was even a study performed by Johns Hopkins University to prove this. Maybe we need a few more studies? Remember, not all studies are good studies. Also, I had terrible heartburn during my pregnancy and Owen didn't come out hairy.
Another risk factor in the medical profession is anesthetic gas. And ways to try and minimize your risk to anesthetic gas exposure. Definitely, you should not be the one who is involved in gassing the patient down. You should make sure that the staff is checking the anesthetic machines for any leaks, making sure the scavenge system is properly connected, making sure everything's well ventilated. But also what you can do is you can wear some personal protective equipment such as this mask, 3M mask with P95 filters. And I bought this at Home Depot. I think it was less than $30. All the vets and the technicians that I've worked with have worn this type of mask, and we all have happy, healthy children. So I think it works. Here's another one, sleeping on the right side. So you definitely want to avoid doing this after 20 weeks of pregnancy, because as you can imagine, you've got baby, you've got extra fluid, all of that in your abdomen, and the right side of your body has a lot of the major blood vessels there. So if you're lying on your right side, you are squashing, or flat on your back, you are squashing those major blood vessels. You are limiting blood flow to the fetus. So you definitely want to avoid that. It can also make you feel very faint and very sick. So avoid that after 20 weeks of pregnancy. Try to lay on your left side or prop yourself up. What about air travel during pregnancy? What's the problem with that? Well, a couple of things. So if you're in late term pregnancy, after 8 months of pregnancy, definitely getting closer to your due date, then you probably don't want to be going into labor on an airplane. You don't have any medical staff there if anything was to go wrong. But also, during pregnancy, you are in what's called a hypercoagulable state, which means that you are more prone to developing blood clots, especially in the legs. And these blood clots can travel up through your veins into your lungs and essentially can lead to death. Typically, after 28 weeks of pregnancy, most airlines will require you to have a doctor's note to say that it is safe for you to fly on an airplane.
Okay, enough is enough. All this talk about things you have to avoid during pregnancy. What can you do during pregnancy? Can you do anything at all? Well, put your feet up, take advantage of your status, nap guilt-free, enjoy your heightened senses, and if all else fails, blame it on the hormones.
If you enjoyed my video, please subscribe, hit the bell button, and come back to see me soon. Bye!